According to the World Health Organization, nearly 15% of adults in India experience some form of mental health disorder. Yet more than 70% of those affected do not receive any form of treatment. India accounts for nearly 20% of global suicides. Economic burden studies estimate that mental health conditions cost the Indian economy nearly $150 billion per year due to lost productivity and absenteeism, impacting businesses and society. As we observe World Mental Health Day, it is crucial to shine light on the importance of mental well-being, especially in today's fast-paced world. We have with us a leading advocate for mental health awareness. Joining me today is Neerja Birla, founder and chairperson, Empower and Aditya Birla Education Trust. Neerja, it's really a pleasure to have you with us. As we've seen that mental health is a huge concern in our country, what is the most pressing concern today?
So yes, lovely to be on this channel, Ambika, as always. I think mental health is usually stigmatized. There is a lot of ground that we have covered. The needle is definitely moving, but that's just a drop in the ocean. There's lots that needs to be done. And especially looking at all the suicides, it's very alarming and it's very sad. And I think, you know, of course, it is a hesitation to speak about mental health, but more than that, it's a fear. I think people are generally very fearful of talking about it. And, you know, that could be because they feel they're not going to be understood, they don't have a support system. In a lot of places, whether it's corporates or whether it's schools, at colleges, universities, I think the fear is that, you know, are they going to be sort of reprimanded for it? So when they're coming from a place of fear, they don't want to talk about it.
Sure.
And unfortunately, mental health is not measurable. It's not something that you can see. It's only the person who's going through it would know that she's going through it. And then that makes it even more difficult and even more isolated. So I think, you know, if we're able to create safe spaces, if we're able to create support systems, I think that will make it easier for everyone to access the mental health care that is available. Because even there is a huge gap. You know, there is a lack of professionals. But even if that is existing, people often are scared to seek help. So if we're able to change that narrative and create safe spaces, more collaborative spaces, and sort of a more more sort of nurturing support system, I think people will also want to seek help and access the mental health care that's available.
You know what you rightly said, giving the support. But again, a huge gap where we see is in treatment. In fact, there's a data which says 70 to 92% of individuals with mental disorders are not receiving the adequate care which they should be getting. Now, how do we bridge this gap? One is about, you know, knowing that you have an issue or seeking help, like you rightly said, you know, that environment, nurture that, but also the ones who require the treatments. Mostly people aren't getting the required treatment.
So I think a very big sort of way forward would be to institutionalize mental health. I think if we're able to do it across sectors and across different sort of operation systems, whether it is schools, colleges, you know, communities, if we're able to institutionalize it, I think that will make it easier to access it. And like I was saying, you know, because it's invisible, if we are able to embed a concept of screening, where actually everyone can be screened, which is what we started doing in our Samvedna project in Maharashtra, is that we would screen people when they would just go to the rural district hospital. And from that, we could tell that people are susceptible to it, or if somebody needs mental health care, and then direct them, refer them to the district hospital. So in that way, we're also, also providing literacy programs so that we can collaboratively work with the district mental health program, because the help is there. I mean, in a lot of places a lot of places it is missing, but if we're at least able to increase the literacy, they will at least avail of the service that is available. So I think, you know, and if we're able to then empower the communities with these resources and make it stigma free, that will also really encourage people to seek help. I think the whole thing is on how do we encourage people to seek help, because in a lot of times the suicides that we see, the young children are just scared to seek help. And so the whole narrative is, how do we encourage that? How do we promote that it's okay not to be okay, but it's not okay not to seek help?
So I think, again, making them comfortable to actually reach out for help. That's important. Like you rightly said, screening. First is awareness, screening, realizing there is a problem, reaching out, and that's where the gap comes. So even if they know there's a problem, there is a gap in the treatment.
Absolutely. And I think the other thing where I really do believe we can help bridge the treatment gap is the use of AI, not to replace the humans, because I don't believe that AI can replace counseling or the human connect, but at least by creating a level of the first level, the initial level, so that that in itself can be a screening of sorts, and then go in for more critical care as and when
maybe
needed.
a person feels, like you said, you can't, human touch is extremely important, but reaching out maybe to somebody you know who's not going to judge you,
Yes.
maybe an easier way to break the discomfort which
Yeah,
people have
yeah,
initially.
yeah.
You were telling us about what you're doing with the program on ground, and Empower, you've been doing this for 10 years obviously, and the kind of work which you're doing on ground. You spoke about institutionalization. I want to ask you a little bit on that. Do you think that really is the solution to reach out to the masses?
Oh, absolutely. So, for example, we're working with the CISF, and that's exactly what we've done. CISF has has been very visionary and has taken on board mental health as a very serious mandate for them. And because they've institutionalized it, it's made a huge difference. We've seen the suicide rate come down dramatically in CISF. They've made screening mandatory. They've put their personnel through mental health literacy programs. So they're trying to create safe spaces, they're creating awareness. And then that also helps people at the ground level to actually seek help. Because when they know that their peers and their seniors are all talking about it and that it's okay to seek help, they're very open and very readily seeking help. So institutionalizing I definitely believe is the way to scale.
And like you rightly said, I think normalizing the conversation. If they're seeing their seniors doing it, their peers doing it, so then it's a normal conversation, right?
Exactly, absolutely.
India, we are the youngest country looking at our youth, but unfortunately 40% of young people in our country report stress, anxiety, and it's linked to whether it's academic pressure, it's peer pressure, social media presence, social isolation. How do you think we can better support young people in our country? You spoke about suicide when it comes to the youth, not just academic, but there's so much out there. I think that's something which we really need to talk about, because being the youngest country.
Yeah. So I'd like in your question when you were even saying about academic pressure. So I guess, reducing the academic pressure, of course, is one way, but I also believe that it's important to build resilience in our youth, to sort of make them prepared for the new world that they are growing up in. We grew up in a very different world, and the youth is growing up in a very different world.
The pressures are different.
The pressures are totally different. It's far more complicated. Social media, yes, has its advantages, but also has its disadvantages. So I think how do we build resilience in our children, in our youth, is I think the way we as parents and the older generation can guide them. Creating safe spaces. Like we've started an initiative called the Human Library, and which is really doing well. So we sort of get together. It's like, each person is like a book, and we're providing them the safe space to speak about their journey, to speak about their challenges. So it's of course very cathartic for the person, but it's very therapeutic for everybody else also listening, because then they also realize that they're not alone, they're not so isolated. Because I do believe loneliness is one of the biggest factors, I think, in this day and age. It's quite ironical, because social media has really connected everybody.
But somewhere you're lonely.
You're also very lonely. So it's, quite dichotomous in that sense. But creating safe spaces, providing them places where they know they're not going to be judged. So that again, they're able to seek help. I keep going back to seeking help, because I do believe that that is really the crux of, being able to resolve this problem, and giving them awareness earlier on, like having preventive programs. So like say screening, for example, having mental health literacy in schools, so that very early on they have the right coping mechanisms, we're able to build resilience, and we're also able to normalize conversations, so that they, or if anybody else is going through an issue, it's not going to be stigmatized. It's not something so taboo. It's not taboo that they can't speak about it.
Neerja, you spoke about stigma. I know we've been talking about mental health for a while, but we still somewhere mental health is connected to stigma. You've been working on ground for so long. Tell me, what would you suggest, or strategies you would like to tell us, which have proven well and effective in changing public attitudes? Because stigma again is related to what people think, or the perspective. What do you think will work?
So stigma is deeply rooted to people's perceptions. Like when we started, for example, the whole perception about mental health was so much in the dark, that people were not even willing to come for any kind of meetings, or like even press meetings, because it was just not known. When we used to approach corporates for workshops, they used to tell us you need to change the word mental well-being. They don't even want the word mental. So it's so much to do with perception. And I think along the way, we've been doing a lot of activations in order to increase that awareness. And that could be like we had a big music program. So music is a great leveler also, and a great way to get people together, because everybody's spending their time for that common cause. It's a great platform to get people of different ages together. So whether it's a music program, we've even done, for a couple of years we did a cycle ride, like a cyclothon. Again, it's a great platform to get people together. So mass media campaigns, any sort of forums which connects different people, different stakeholders, whether it's women, men. So for women, for example, if it's perimenopause, that's, I've been talking about that because even mental health has such a huge relevance in that.
The mood swings, anxiety.
Exactly, the low mood. So again, creating a forum for that. So trying to create that peer network, that support system. So, these are different ways that we've been trying to do, that we've been doing to get
the stigma,
people,
I think, somewhere.
To break the stigma, to get more conversation going, to normalize the conversation. And I think get people to realize more and more the impact of mental health.
Yeah, and like you rightly said, I mean, perimenopause, of course, being in that age or whatever, you're talking about it today, but in every sphere, whether it's teenagers growing up, so giving them that safe space, what you had said earlier as well. But lastly, when we, Neerja, look at Viksit Bharat 2047, the Honorable Prime Minister has spoken about it. When it comes to mental health, when less than 1% of the GDP is being spent on it, how long do you think the journey is? When will we really reach there? And how can we reach there with looking at amount of money being really spent on mental health?
Yeah, so clearly, if you do the math, we definitely need far more funding in mental health. It is very less, and it's just a drop in the ocean. And if we need to reach the goal, which we have to and we must, be on that journey and reach that goal, then the way would be to really uplift the youth. And mental well-being, I believe, is the fabric that really goes through it all. So till we don't address the mental health of the youth, that goal is, far. So we have to do that in order to reach that goal. And definitely we have to pump in more money. It definitely needs more funding. It's very, very under-deserved. And, and also, work more with the government, have far more partnerships with them. Have more projects to scale up. There's a lot that one can do, and just need all stakeholders to come on board for that, because we can do what we want to do, but till the mental health and mental well-being of the youth is not in the right place, how are we going to see a more productive nation?
Because the youth really is our future. They're going to be, when we look at 2047, they really are going to be the future at that point. And collaboration, stakeholders, talking about it, I think these are the most important things. Awareness, screening, I think you said all that. We really need to look at mental health as a whole, I feel, really to bring about a difference towards a happier nation. I think productivity, of course, but happier nation.
Yes,
Thank you so much, Neerja. It's really been a pleasure to have you with us on NDTV on World Mental Health Day.
Thank you so much, Amika. Pleasure to be here.